I'm Bridget Amata in for Howard and Lauren tonight. More than half of the state's ICU beds are occupied. Now the president of the Hawaii Nurses Association is sounding the alarm, saying if the upward trend in COVID-19 cases continues, hospitals will face a staffing crisis. Max Rodriguez has more in a story that's new at 10.
Hospital officials tell us they have plans to add more ICU beds if the number of COVID-19 patients goes over capacity. But now some are worried that there won't be enough nurses to care after those sick patients. The latest rise in COVID-19 cases is worrisome for state officials, but even more for those who are treating the patients.
It's anxiety over what's going to happen in about a week. So, on average, you get 10% of those numbers in about a week is what the rate of admissions go up. So if there were 300 a day, in about a week, we'll see about 30 admissions.
Registered nurse and president of the Nurses Union, Daniel Ross, says the current rate of admitted patients is not sustainable for Hawaii.
And right now, the way the numbers are climbing, we're sliding into a crisis. It's scary. The nurses know it. The hospitals are filling up. We're already having staffing issues on certain units.
Lieutenant Governor Josh Green says the number of COVID-19 patients in hospitals has doubled since the beginning of August.
In this 2-week period, 81 plus additional people have been hospitalized. And unfortunately, some people do die, as we heard today. And our hearts just break when we have to report that a young person or an older person has been sick. And most of the fatalities have been among the older individuals, our kupuna, but we did have a 44-year-old who passed away.
With more than half of the state's ICU beds occupied, the lieutenant governor told hospitals today to be ready to expand beyond capacity if necessary.
And I think everybody understands if in a couple of weeks, 2-3 weeks, things continue, and things get really bad, a lot of these best practices will go right out the window because it will be unsurvivable.
State nurses are also calling on hospitals to be more transparent about how much personal protective equipment is readily available, as well as more access to COVID-19 testing. Max Rodriguez, KH12 News, working for Hawaii.